Ready?
Yep.
Okay. How are you doing today?
Good, how are you?
Good. My name's Matt. I'm going to be your nurse. I have everything I need. I have my stethoscope. I have my gloves and my pen light. Just need to wash my hands, okay? Alright, so I'm just going to have you answer 3 quick questions for me. Can you please state your first and last name for me?
Macy Stoll,
Okay. Where are you from?
Freeport, Maine,
Okay. And where are you right now?
the University of New England.
Alright, awesome. So patient's level of consciousness is excellent. Speech seems to be clear and patient seems to be well oriented. So what I'm going to have you do is remember these 3 words, okay, for later. I'm going to have you remember ocean, basketball, dog, okay? So I'm going to have you stand up real quick. Okay, can you just walk to the door for me and back? Okay, so patient's gait seems to be good. No signs of swaying. Able to balance correctly. I'm going to have you do one more thing with balance. Just lift up one leg for me. Try to balance. Excellent. Other. Okay, so patient is able to balance. Excellent. Next thing I'm going to have you do is I'm going to have you raise your eyebrows for me. I'm going to have you puff your cheeks, smile, frown. Alright, awesome. So patient's facial nerves seem to be intact. Lift up the shoulders for me. Alright, spinal nerve seems to be intact as well. What I'm going to have you do next is I'm going to have you go like this. Perfect. Other way. Alright, so patient's fine motor skills seem to be intact as well. Next thing I'm going to have you do is close your eyes for me again. I'm just going to touch 3 spots on your body. Just let me know where I touched, alright?
Elbow, knee,
Alright.
shoulder.
Alright, so patient's sensory motor skills seem to be intact. What I'm going to have you do is close your eyes one more time. Stick your arms out like this. Just try to balance like that for a second. Okay. Alright, so patient passes the Romberg test, able to balance, no signs of swaying. Okay, you're good. You can open your eyes now. Okay, so next thing I'm going to have you do is I'm going to have you one big circle. Perfect. Another one. Any pain with that? Alright, perfect. Bend at the elbow for me. Okay, other one. Perfect. Twist the wrists. Okay, range of motion is full in wrists, elbow, and shoulder. No crepitus or pain noted. Okay. Next thing I'm going to have you do is I'm just going to have you step a little bit closer to me. Okay. I'm going to have you push your leg back. Okay. Forward. Same thing with the other leg. Okay. Then I'm going to have you just go like that with your leg. Okay. So full range of motion within the hip. Any pain? Okay. No pain or crepitus noted. Then I'm just going to have you bend the knee. Make sure you have, okay, full range of motion within the knee. And now just circle motion with the, okay, so full range of motion within the feet. Any pain with any of those movements? Okay, no pain noted, as well as no crepitus. Okay, what I'm going to have you do now is I'm just going to have you stand straight for 1 second while I palpate the spine. Okay, so shoulders seem to be even and level. I'm just going to have you bend over right at the waist. You can stop. Perfect right there. Okay, so no masses or lesions noted. Any pain with that? Alright, no pain noted. Cervical spine seems to be aligned correctly. Next thing I'm going to have you do is I'm going to have you sit down. So before we get started with the whole head to toe, would you do you have any assistive devices that you use? Alright, any pain today at all with anything? Okay, so no pain noted and no assistive devices used. Alright, so first thing I'm going to do is throw on my gloves. Having a little bit of a struggle here with the gloves, not too big, bounce right back. Alright. It's hard to find a glove size, with my hands just a little too big. So what I'm gonna do now is I'm just gonna assess the hair really quick, okay? Alright. Okay, perfect. So hair seems to be evenly distributed, no signs of masses or lesions or critters. Alright, so next thing I'm gonna have you do is I'm gonna ask you, do you have any pain within the ears right now? Okay, so no pain noted. Ears seem to be equal in size bilaterally, good shape on the head. I'm just gonna look inside really quickly just to check. Okay, no mass or lesions in the right ear, no drainage seen. Okay, so no drainage noted bilaterally, and no mass or lesions in either ear. So what I'm gonna do is I'm gonna have you close your eyes, okay? And I'm just gonna whisper a word, and you're just gonna have to respond to me, okay? What was the word?
New England. Softball.
Okay, so patient passed the whisper test, able to hear with their eyes closed. All right. Next thing I'm gonna have you do is I'm gonna have you move your head side to side, look like you're already doing it. So, okay, perfect. Up, down. Okay, and then I'm gonna have you push against my hand. Okay. Okay, so full range of motion with the neck. Neck seems to sit erect and centered on the head, and strength is 5 out of 5 bilaterally. Next thing I'm going to have you do is I'm going to assess the eyes. Okay, so eyebrows seem to be equal, bilaterally, and eyes seem to be oval shaped. They look healthy. I'm just gonna. Okay, so eyelid seems to be pink and healthy. So let me look right into your eyes. Okay, so sclera looks white, smooth, and transparent. Iris color looks to be evenly distributed. Cornea seems to be clear, and conjunctiva seems to be clear as well. So what I'm going to have you do now is I'm going to have you look at this, and I'm going to have you follow in 6 directions. Okay, ready? Good job. Okay, so patient passes the fields of gaze test, able to move eyes accommodantly, and not with rapid movements, with normal, calm movements. So what I'm going to have you do is look straight ahead, okay? Alright, perfect. So pupils are equal, round, react to light and accommodation. One last thing for the accommodation, I'm going to have you follow this right to your nose, okay? Perfect. So pupils are equal, round, react to light and accommodation. Next thing I'm going to have you do is let me know, is there any pain within the nose at all? Okay, so no pain reported. Nose seems to be symmetrical bilaterally, as well as the nares. Fits the face well. No masses or lesions noted. Just gonna look right inside real quick. Just tilt your head up a little bit. All right, perfect. So no deviated septum noted. Next thing I'm gonna have you do is perfect. Any pain with that or anything? Okay, so patency of the nares is equal bilaterally. Excellent. Lips seem to be red and moist. Skin seems to be pink, dry and warm to the touch. No tenting, and capillary refill is under 2 seconds, which is excellent. Means you're well hydrated, which is great as well. Next thing I'm going to have you do is open up the mouth for me and tilt your head back a little bit and just say, no, you can a little more closer, like there you go. And then just say ah. Stick your tongue out a little bit. Ah. Alright, uvula midline, tonsils are are present. Mucous membranes are pink and clear. Keep going. Mucous membranes are pink and clear. Teeth look excellent, nice and healthy. That means you brush your teeth a lot, which is great. Stick your tongue out for me one more time. Open your mouth and stick your tongue out for me. All right. So tongue is symmetrical, not deviated one side or the other, which is great. Now I'm gonna have you. Just gonna have you lift your shoulders up for me. Okay. So strength of the shoulders is 5 out of 5 bilaterally. Now I'm gonna have you stick your arms out like that. Push up and down. Okay. And then I'm gonna have you, what's it called? Put your hands down here, okay? I'm just gonna have you push up against my hands. Okay, now down. Alright, so strength is 5 out of 5 bilaterally within the legs. Next thing I'm gonna have you do is push up against my hands with your feet. Okay, so strength is 5 out of 5 bilaterally. Now flex your feet up like that for me and push down. Okay, strength 5 out of 5 bilaterally, excellent. Next thing I'm gonna have you do is bend your arms like this. Push up, push down, down. Alright, so strength in the elbows, bicep and tricep are 5 out of 5 bilaterally. Next thing I'm gonna have you do is I'm just gonna take a few sounds of the lungs, but first I'm gonna have you stand up. And I'm gonna have you turn this way. I'm gonna have you take a deep breath. Alright, chest expansion is bilateral. Patient seems to breathe quiet and effortlessly. Chest wall seems to be cone shaped. And chest seems to be non-tender with no crepitus. Okay, take some lung sound. Deep breath. Deep breath. Deep breath. Deep breath. Last time. Deep breath. One more. Okay. So right and left lung sound seem to be equal bilaterally. No signs of bronchi, crackles, or wheezing. I'm just gonna have you sit down again. You're all set for standing. One more thing before we move on. What was the name? What were the 3 words that I told you to remember?
Ocean, basketball, and dog.
Perfect. So patient's short-term memory seems to be excellent. Able to recall the 3 words I told her to remember at the beginning of the assessment. So what I'm gonna have you do now is I'm just gonna take one more set of sounds, but now they're gonna be from the heart. Okay. Just breathe normal. Perfect. So S1 and S2 are present, meaning mitral and tricuspid valves were working correctly. No signs of effort. Chest seems to be cone-shaped, which is great. Left and right sound seem to be equal bilaterally. And just one deep breath for me. Okay, so chest expansion seems to be symmetrical bilaterally. I'm just gonna have you lay down for me. Okay, I'm just gonna assess the bowel sounds. Is it okay if I lift up your shirt a little bit?
Yeah.
Alright, perfect. Alright, so abdominal region seems to be strong, no signs of tenderness or distension. Alright, so bowel sounds were heard. as well as vascular sounds. No type of hypo or hyperactive sounds were noted. So that's excellent. Stomach seems to be working perfect. What I'm going to have you do now is I'm going to do exactly what I did before with the range of motion and strength, but now with your hip and your knee, okay?
Mhm.
So what I'm going to have you do is push up, okay? Push up, okay? And then I'm going to have you sit with your knees bent a little bit, okay? And I'm actually going to reassess bowel sounds now because I forgot you have to have your knees up and bent, okay? Just a few more seconds. Okay, so bowel sounds are present just as they were before. No signs of hyper or hypoactive sounds. Range of motion in the hip, the knees, and the foot are 5 out of 5 in full. And strength. Next thing I'm gonna have you do is I'm gonna have you sit up. And next thing I'm gonna do is just assess some pulses, okay? Okay, just listen to these a second. Okay, so carotid pulses seem to be even and symmetrical bilaterally, 2+, with no bounding pulse at all, which is great. Next thing I'm going to do is I'm going to take your radial pulse. Okay, good. Alright, good. So patient's radial pulses are equal and symmetrical bilaterally, 2+ with no bounding. And what I'm going to do is just the last pulse down here. Good. Alright, perfect. So pedal pulses seem to be pedal and tibial pulses seem to be equal in strength bilaterally. 2+, no bounding pulse, which is excellent. One of the last things I'm going to have you do is I'm just going to assess the lymph nodes, okay? Okay, so lymph nodes, no pain or tenderness there? Okay. How about right here? Okay, so frontal and maxillary sinuses are not tender, or no pain reported as well, which is good. And lymph nodes are not tender or no pain noted from the patient, as well as not palpable. Trachea is midline, and thyroid is not palpable as well. All excellent. Last thing I'm going to have you do is I'm going to I think I'm good. I'm all set. You good? Awesome. Thank you very much. What is the password?
130, 337.
Oh my God, 1930.